joining us. And what Dr. Weinstein and myself are going to show you is we're going to show you a presentation along the lines of bringing veterinary medicine to the 21st century. You already understand what that means. You have a very effective way at the moment to contact and communicate with your clients. What we're going to show you is how you can educate them, how you can build a fence with this application and with the information, a fence around your clients so they do not leave you, and so that they, as a result, the number of client transactions grows in your practice.
So you guys are already vet app users, so you are already in the 21st century. At least one leg is in the 21st century because you're using technologies that are modern. They're far and away much more progressive in the eyes of the consumer when they know that you have an app already. And you also know that it has various resources and tools already built into the app itself, whether it's the appointment component or the RX refill or even this direct call to your practice. So this tool that you're already using is huge. It's new. It takes you and differentiates you from those practices that are around you. However, did you ever think about it as a marketing tool? And in the 21st century, I was meeting with 25 hospitals last night, and we were talking about how things have changed and how the yellow pages, which used to be the mainstay of marketing and our most expensive expense when it came down to our marketing budgets, is basically gone the way of the dinosaur. And now we have all of these new technologies and digital approaches to the way we communicate with our clients, and you're already using it. But did you think of it as a marketing tool and as a resource that you can use to help increase the relationship that you have with your clients? Now, I know marketing is not something that veterinarians are very comfortable with, so let's start with what I think is a comfortable definition. And that's a definition from John Jansch, which is getting people who have a specific need to know, like, and trust you. If you take this application of the term marketing and compare it to what most of you think, which is TV, is in yellow pages and radio and newspapers and park benches and buses and Goodyear blimp floating over the Super Bowl, it's a much different, much softer, much more professional and service-oriented definition of marketing, and one that I find most veterinarians can accept. So think of marketing as getting people who have a specific need to know, like, and trust you, and as a result, take action on that need. So that's the definition of marketing that we use as the premise for everything that we talk about. And let's just talk about marketing in general. Steve?
Yeah, first I want to emphasize what does it mean, specific need, and this is the true power of retention marketing. You can replace marketing with education. Doesn't matter, but what it means is that if there is a way for you to have clients, different clients among your client base, to receive such messages from you that they say, aha, this message matters to me. Aha, I didn't know that I needed to do this for my pet. Aha, I didn't know that I have to take action now. If you have the ability to engage your clients for what it is that they specifically need, every client, your clients are not one group. Every client wants something else. Groups of clients of yours want different things based on different criteria. If there's a way for you to give the right information to the right client and then drive them to take action, and if you are able to position yourselves as the solution provider, then of course they're going to call you. Of course they're going to trust you because, hey, you speak my language. Hey, you know exactly what I need. Hey, you know me. How do you know me so well? If you have the ability to do so, the specific information will create action, and the action will create trust, and they will not leave you. So It is the basic tenet of retention marketing is to keep the clients you've already got. We cannot take the relationship we have with our clients for granted. We cannot assume that once we got those clients in, we can forget about them. There's study after study that show that clients leave us, that clients travel to other practices because they do not have a strong bond with the practice. So I want to share with you a quick anecdote here to illustrate the importance of this message. I have a colleague who runs a large emergency clinic in Dallas, Texas, and I recently met with him, and he said, "It is amazing, Steve. I've been running this practice for 15 years. When clients bring their pets in for emergency, one of the questions we ask them is, who is your regular vet?" And he says, for 15 years, 75% of pet owners say, "I have no idea who my vet is. I have no idea who my vet is. I don't care who my vet is." 75%. It's enormous. If you have a way to stand out, if you have a way that any time a client thinks of veterinary care, they think of you, now you have a client who's always committed to you.
So with that in mind and with the definition of marketing in mind, what we think is marketing is education. I think that we as a profession need to do a much better job of educating and informing our clients about their pet's needs and how you can solve any problems that may occur, because we are all professional problem solvers. By having transparent, open communication and by providing information in terms of education, maybe we can put Dr. Google behind us and be the go-to source for information within your pet owners and your clients. And then with that education in mind and with communication, we start to build relationships. We start to get clients to come in more frequently and provide a higher level of care. And the reason ultimately, because of this, we have built a stronger relationship. We have built a bond and we have built a trust. And once you start to build that trust, the education is easier, the relationship becomes tighter, and your marketing becomes focused on continuing to build and tighten relationships so that they won't want to go anywhere else when it comes to the provision of veterinary care. Steve?
Very well. So now if we were able to deliver to you the message that staying in touch with your clients in an effective way, then it comes down to how can I get my clients to respond to my messages. There are 3 tenets in reaching out to your clients: creating the specific need, creating an action, and building trust. And that tenet is termed as the 3 M's. First M is market, the second M is message, and the third M is media. Market is got to be a way for you to be able to search and sort or segment your client base based on specific needs. Actually, we're going to tell you what these needs are in a moment, but specific needs so that every group of clients get a specific message. Because why? The more specific the group, the purer the message to that group, the greater the response. Message means is that it is not enough to use logic, simply logic, when we communicate with clients, because people respond to emotional meaning much more than they respond to a logical meaning. So there's got to be a way for you to connect with your clients on an emotional basis and then justify purchasing your service at your practice with logic. First, you need to open the door, and that door can be most effectively opened through emotion. So the message you reach out to your clients with has got to engage them emotionally first. The third component is media, because you don't know exactly how your clients respond to your messages. Some clients prefer a phone call. Some others still prefer a postcard or a letter. Others prefer a text message, while others prefer a different way, and this is what we're going to be focusing on. More and more people are attached to their phone, and so why not reach out to them on their phone, educate them specifically with creative messages that will engage them and get them to take action.
So What is successful marketing? Well, there are 4 components to make marketing successful. It has to be based upon needs. It has to be frequent and repetitive. One stop, one hit is not sufficient to get most people to take action. There has to be an action item component to it. Clients, if they don't know what they need to do, they need to be told what to do and encouraged to do so. And you have to use different modalities. You cannot no longer just use a letter or just use a postcard or just use an email. Clients want to be catered to, they want to be communicated to the way they want to be communicated to. So you have to know what's available out there in terms of different methodologies, different modalities, and tap into those to create a customized experience for your clients. So let's address each of these individually. When it comes to needs, as a practitioner and as a practice, you have pets that have specific needs. Older pets need senior care. 85% overall of all pets over the age of 3 need dental care. And certain breeds have higher risks for certain conditions. You are problem solvers in your practice, so you need to communicate to your clients what their pets' needs are and how you, as a healthcare professional, can help address those needs with the products and services that you provide. So successful marketing is based upon addressing the needs of your clients and the needs of their pets so that they ultimately take action to provide a higher quality of life and a higher quantity of life for their 4-legged family members. Steve?
So what does it mean that needs-based? You see, your clients, by default, only take action on something. They only call and make an appointment when they feel that there is a need. Only then. So what does that mean? It means that a non-professional is then given the responsibility of seeing something going on with their pet and knowing what to do about it and knowing who to do about it. But we know that as we speak, there's a ton of your patients walking around or lying down with problems, pain, dental problems, joint problems, overweight problems, parasite problems, ear problems, etc., 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 etc. However, we know that pets do not communicate well with us, or perhaps we don't understand how they're communicating with us well. Therefore, from day to day, there are a lot of pets who are suffering unnecessarily without anybody noticing. So need-based means is that let's identify the clients who have pets with specific needs or likely to have a problem before they even realize there is a problem. Let's educate them properly and in a way that will engage all their senses. And let's use the most effective tools to educate them with, and let's then give them a clear call to action, which cannot be other than call us or make an appointment. Now we have a way to increase the number of client visits. When it comes to, Peter, do you want to talk about the frequency?
Well, sure. I mean, it's pretty evident even in our own world when we're making decisions on what to buy for our families that advertisers are using multiple messages in multiple fashions. Well, you have to do the same thing within your practice. One shot doesn't work. Think of it as the anamnestic response that a pet or a puppy has when you give it a vaccination. You give it a vaccination and its immune system responds, but over time it starts to wane. So you have to give it another vaccination until you eventually build up the immune response so that the dog is capable of responding to when it gets challenged. And the same thing for cats, obviously. Well, your clients need to have that same approach when it comes to marketing. One shot doesn't give them enough information or give them enough drive when it comes to needs to get them to take action. In fact, marketing studies indicate that it can take between 5 and 12 exposures before a client will take action on something, and it can take even more if they really don't even know that there's a need there. So not only do you focus on needs, but you have to touch the client multiple times and address them about that need before they'll actually take action. Steve?
So, Peter, when we tell people you need to touch your clients 5 to 12 times and perhaps more, we commonly get the reaction. Wow, isn't this too much? Aren't we going to alienate or irritate our clients? And we say, no, quite the contrary. As long as your messages are to the point, as long as they are interesting to them, as long as they are of value to your clients, not only will they not resent your messages, they will welcome them. They will wait for them. They will react immediately to every message they receive. It's just like receiving, if you are a sports fan, don't you agree that every time you get a piece of information about your preferred team or player that you want to read it, you want to read more? Same thing with the clients. If you can bring them to a place where they are waiting and expecting to receive messages from you regularly because there's so much importance in reading these messages, they will be very receptive to them. And I want to say that sending one-time reminder is not going to get the reaction you want from your clients as it is to reach out to them and always be in their presence, continue to build that relationship, deepen the trust, and show the world that you are the practice for them and no one else.
So the message also has to have a call to action, something that will get them off the couch, put the remote down, get in the car, or make a phone call. And the call to action can be anything from making an appointment to coming in for a weight check, for a free dental exam, whatever the case may be. But you make sure that there are calls to action in those communications as well. Educate, repeat, have a call to action, and finally, use different technologies to get their attention. It's no longer a simple postcard. Some clients would prefer to receive an email, some a text, some a phone call. There are so many different modalities out there, and you have one at your access that you are using virtually every day as a means of communicating with your clients, and that's the Vet app. So what we want to talk about from this point on is how you can use the Vet app for marketing. Steve?
So first, you are members of the Vet app because you see the value of reaching out to your clients repeatedly, having an open channel of communication with them through their smartphone. You recognize that most people use their smartphone all the time, more than any other way. And if there's a way for you to reach out to your clients, grab their attention, and call them to take action, the first action you're going to want to have them to take, very simple action, is read the information. And so you do this through a push notification. So every time your client signs up for your downloads the application and allows push notification, now you have an ongoing open channel of communication with them. If you send them a succinct message to the point, and if this message matters to them, and if the call to action is, please click on me because there's more information behind it, now it takes them to another page where there's even more engaging information, where you can continue to explain, to engage them about the importance of continuing to read, learning, mastering the knowledge, and then you clearly tell them this is what we ask you to do. And if the call to action cannot be to jump from the floor to the ceiling. There's got to be a step call to action. So one step, next step, simple steps of calling them to action, but once they get engaged, you walk them down the right path, which eventually is to give you a call, which eventually is to call you and ask a question about this, where there's somebody on the other side of the line who knows how to guide them to come in, where there's somebody on the other side of the line who knows how to, when they come in and they're in the exam room, somebody knows how to get them to say yes. Now you completed the chain, and you have a very effective way to generate a lot more business for necessary services.
So you're thinking, but my clients don't want to be bothered. They get enough information. They're bombarded. Well, let's think about that. Here are some survey results over the past 12 months. 85% of the respondents consider their mobile device a central aspect of their life. How many of you have almost dropped the telephone in the toilet because you brought it into the bathroom with you? I didn't think that could ever happen until my wife almost did it. How many of you wake up in the morning and the first thing that you grab before you grab a cup of coffee is your smartphone to see what you missed over the last 6 or 8 hours? almost half of the American population can't go more than 24 hours without their smartphone. Think about that. You cannot go a full day without touching your smartphone. I know I'm one of those. You go through withdrawal, whether it's a couple of hours or a couple of minutes. Try sitting through a movie for 2.5 hours without looking at a text message that just came through. Over the past year, smartphone app usage has increased by 44%. That means more people are using more apps. And whether it's the Facebook app or the SportsCenter app or whether it's a weather app or whatever the case may be, there's been a 44% increase in the use of apps, specifically on smartphones to access information. And finally, the average consumer, and you have average consumers coming into your practice, launch apps 10 times per day, and the addicts launch them 60 times per day. Personally, I think I'm right in that 30 times per day, so I'm normal pushing addiction right now when it comes to the use of my smartphone. You have clients that want information through their smartphone. 98% of searches for services in your community are done through smartphones. So you've got a tool, you've got a logical reason to use it, and so you have the tool there. The clients are attached to it. You can now use it to educate, to inform, to stay in touch, and your app is specific to your practice. So think about it. Why not use it to enhance your relationship and to motivate some additional action through your clients? Steve?
And I want to add one more thing to this, is that over the recent years, we have been trained and educated to trust that there is a solution to any problem, and all you have to do is have the right app for it. There is an app for every problem. There is an app that your clients are having at the moment because they know that you can provide a solution. They trust this app. They trust this app, I tell you, a lot more than they trust your website. It is a lot easier for them to engage you through the app than through the website. Now, they trust you, they trust the app, and they trust more the information that you supply to them on the app than they would through Dr. Google or even through your website. So you have a wonderful tool that has a lot of trust behind it that people are getting more and more used and accustomed to using. Now, let's find a way to educate them and take action at your practice.
So we, working with the Vet app, have helped develop some educational content for your clients with calls to action. And they focus on the most common needs of all pets. So you now have that additional touch point. Remember, we talked about 5 to 12 touches before clients will take some action. So in many cases, your app has been more of a passive component of your clients. We want to encourage you to use your app to become more of a two-way communication tool and use it to be more aggressively touching your clients from a retention marketing standpoint. So educational content that is sent to your clients, focusing on the more common needs and with a specific call to action. So you now have an ability to turn on your app and turn on your clients concurrently. Steve?
I want to stress the power of words. If you think about it, words are not just an assemblage of letters. They carry an energy, and that energy generates a reaction in people. If you know how to put the right words in the right order, and if you can thus channel the energy behind these words to connect with your clients and get them to take action, now you have a good response. The question then is, how do you create the right words? Well, Dr. Weinstein and myself, in addition to being in the profession for a good many years and working as veterinarians and knowing exactly what drives clients to take action, we also have tremendous knowledge and education on how to use the right words. So you don't have to worry about them. It's already there. We've created these words for you. We've created the phrases, the sentences, the educational materials, which will move your clients to take the right action. And that's there available for you.
So we didn't talk about retention marketing in a global fashion, but retention marketing as a concept focuses on keeping your existing clients, engaging them in your practice, putting a ball and chain on their ankle so they're not going anywhere. And it does so by providing education, information, and doing so with multiple touches using multiple modalities. Everything we've kind of touched on up until now. And this concept is will grow your practice by engaging your clients to come in more often and spend more money because they will understand the needs that their pets have. So we take retention marketing as a focus and combine them with the Vet app, which is a tool, and you now have a great way to use modern technology to outreach to your clients, to nudge them, to educate them, to get them to get off the couch and take some action, and it's in the palm of their hands where they are constantly looking anyhow. So here's a synergy that's a win-win. Educate your clients using modalities that they're already using to increase their knowledge, increase their understanding, increase their trust with you, and ultimately come in and have services provided. It's a win-win from that standpoint. So we've created some additional information in terms of specific campaigns that you can choose from. They tie into push notifications, as well as other features that are part of the Vet app and providing information from that standpoint. And in our experience with retention marketing, anytime you can increase communication, you increase compliance, you increase better patient care, and subsequently you increase your client retention. So think about the combination of the two, giving clients what they want in the way they want it, and then giving them additional education and information with which to take action.
Yeah, I wanted to stress the word automated because one concern may be, well, how do I do it? Do I have to think about it? When do I send it? How do I send it? You don't have to worry about anything. Do you have an app already? Now you have the right education to the specific group of clients with a specific message, with a specific call to action, enough times to generate the kind of reaction that you want. And it's all going to be done for you. You don't have to worry about it whatsoever.
So the use of push notifications, Steve, you want to talk what push notifications are?
Yeah, so the push notification is a gentle knock on the door to your clients. Look, there's some interesting information. If it is not for them, they just ignore it. If they feel, this information is important, it's engaging, what information is standing behind that message? All I have to do is click on it. It doesn't waste any energy. Click on it. Now I get more information. Now I get more value for clicking on push notification. So when your clients authorize push notification with the application, now you have a really open channel of communication, and you can choose, or the clients will choose themselves, what messages matter to them and what to do about them. So you're always going to be in the present, always. They can be away from the desk. They can be at lunchtime. They can be anywhere. They get engaging information. They feel it is the right time to open it, click it on it, read it. They do. It's there. And immediacy is crucial with this system.
And there's an example of a call to action that you would see in a push notification. There will be other calls to action based upon a variety of different campaigns that have been created that you can have access to. And these are just some of them. There are the more common campaigns and the more common issues that you talk with your clients on an everyday basis. 85% of all pets over 3 have dental disease. 40% of all pets that come in are overweight or obese. Depending upon where you are in the country, internal parasites are a huge issue and external parasites the same. Heartworm disease. There's a variety of different things that every day you talk to your clients about, but they leave the practice and they don't think about it. Here's an opportunity utilizing a tool that they have in their lap or on their hip or in their pocket, and an access point that you have through your practice management access to the Vet app to be able to communicate with them when they're not in your practice. And clients want to hear from you. They want to know what's going on. They don't want to just get a reminder once a year that it's time for a visit. They want to be in touch with you on a regular basis, non-intrusively, that keeps them informed and keeps them educated about the different things that their pets may need and that you can provide answers for.
If you can become the source of information for them in a very simple, ready-to-use way, you will gain their trust. So this allows you to be that source of ongoing, useful information for them.
So you have great content. You're extremely intelligent. Your staff is extremely intelligent. But it's not just the content. It's how you deliver the content. So content is king, but the context that you send it in is the difference maker. Everybody has access to the same content. It's how you get the content from your hospital to the hands of your clients that will differentiate them, give them the personalized care, the customized communication, addressing their pet's needs, and do it differently than every other hospital within your community. You can truly stand out by utilizing the thoughts that say, my clients are on their phones, why aren't I communicating to them in that fashion? So let's wrap it up. Let's talk about, just in summary, what we've kind of covered. Marketing is a difference maker. There are a lot of practices in your communities. Each one does the same services, spays, neuters, vaccinations, exams, etc. But the ones that are busiest, the ones that are having clients come in more often, are the ones that are communicating with their clients on a regular basis, consistently, using education, teaching, and improving the client-patient veterinarian relationship and building trust. When it comes to marketing itself, retention marketing is the most cost-effective way to communicate with your clients. They're already yours. They want to hear from you. Reach out and touch them. And with education marketing, what you're doing is you're taking and giving them information that they want to get from you, that they don't want to have to go look up from some other resource, and it's coming from a trusted healthcare professional. Not only that, but in the context of what we're talking about, it's coming from a trusted healthcare professional to a tool that they have with them all the time, and it's using a resource in terms of the Vet app that's innovative, 21st century, different, something that they're used to using with other industries, but now is available in the veterinary industry. So think about that, an automated marketing program to your clients who want to hear from you, utilizing the resources that they have to learn about it, and I can only see it increasing your number of client transactions and subsequently building a stronger relationship and a higher level of care that you can provide for your clients and their pets.
So the brutal truth is that your clients have no way of telling whether the injection you've given their pet is any better than anybody's injection. Whether the spay, the diagnosis, the treatment, anything you do is any better than anybody else. And I must say that there's no way for your clients to tell that the $80,000 digital X-ray machine you have in your practice and which you're so proud of matters to their pets more than any other practice, or that the ultrasound machine you have in your practice matters nothing to your practice as much as how they feel about you. What matters to people is how they feel about you. Nobody's going to turn around and tell clients, did you see the digital X-ray machine they have in their practice? Nobody does that. What they do instead is, this practice is so wonderful. The way that they engage me, they give me the feeling that they care about me. That's what matters to people. So with this application, with this content, you now have a way to drive that feeling that your clients have for you into brand new channels. And this is how you keep them coming in. This is how you end up using your X-ray machine, your ultrasound machine. This is how you stand out.
So quickly, because Zubin mentioned it earlier, you can find this on Amazon, Retention Marketing for Veterinary Professionals. This talks about the global concepts of marketing, extends it into retention marketing, and provides you with some great resources and opportunities to enhance your client experience and enhance your client relationships. On that note, Zubin, let's open it up for questions that hopefully people have posted that we can answer regarding the concepts of marketing, or that you can answer regarding the Vet app and the retention marketing concepts.
Actually, Peter, I think we're going to go to how the program works, how the THEVETAPPLus works, and then we'll open it to questions. How's that?
Sounds like a plan. Guys, take over.
Great. So I am just opening my screen. Thank you, everybody, for attending today's webinar. We did have a great turnout. And thank you, Dr. Kornfeld and Dr. Weinstein, for a great presentation and some really great information. Just to give everybody a little bit of background, and as you know, clients come to us, very, very frequently, if not over frequently, that asking us, we love the app. Can you help us get content on here? Can you help us with updating our news page, sending out push notifications for us? So we turned to the experts in the industry, Dr. Kornfeld and Dr. Weinstein, and came up with this program to bring our clients just that, phenomenal, effective, relevant, important information so you can stay top of mind with your clients, be sure you're educating them. So I'll quickly go through how the program, the THEVETAPPLus, works. Included in the THEVETAPPLus, so in addition to the Vet app program, your mobile app, I should say, you will get 13 campaigns, okay? Each campaign will include compelling content for your news page that includes both messaging, text, and graphics. It will also include 2 push notifications. The push notification will go out at approximately the first day or second day of the month, as well as around the 15th of the month. The more you communicate consistently, the more that people will engage with the conversation and engage with the education that you're providing. What's great about this content is that you're going to own this content, okay? So you're encouraged to use these ideas on your social media, in your newsletters, on your website, okay? Next, this is a full-service offering, so it's fully automated. There's nothing that you have to do. We'll get the news page updated for you, and we'll get your push notifications out. So for those of you that haven't been updating your news page or sending out the push notifications as frequently, now your app will become a very active tool, part of your client communications, okay? Some of the, and I know, Peter, you covered this, so I'll go through it quickly. The menu of 13 campaigns, there's a menu of 13 campaigns to select from. Some of the topics include weight loss, feline, emergency, allergy, heartworm, pain, lumps, senior issues, referral, wellness, worrisome, breed, and dental, okay? I think I already mentioned the rest of the items on this page, so I'll go into more of the details. But here's what's really great. And Dr. Kornfeld or Dr. Weinstein, if you want to elaborate on this bonus offer, please feel free to. But included with all that content will be a monthly recorded educational webinars, as well as a quarterly live teleseminar with an open discussion with Veterinary Success Services. So a great offer to really get Dr. Weinstein and Kornfeld's feedback and learn from who we consider the experts in the industry. Did Dr. Kornfeld or Weinstein, did you want to elaborate on anything here?
Sure. So the reason we do all this is that Dr. Weinstein and I have a mission to help our profession grow in any way we can. We've been working diligently for years on making our profession a better place to park one's career. We want to help you more successful, to be more successful. We want to help you and your team feel better about coming to work. And that's why we go out of our ways to help you. We want you to be successful. This is our main goal. So we know that with the content that we've created for the Vet app and for you, you will get clients calling you. But you have to think about it. This is only part of the formula for success. Why? because there's still somebody who needs to know how to handle these calls. There's still somebody who needs to know better than before how to get those clients to make an appointment, and then to come in, and then to go into the exam room and say yes to what the doctor recommends. And because we want to help you be even more successful, because we are grateful for the opportunity to do this for you, we have created 12 webinars which are going to be focused specifically on how to make the right changes in the way that you conduct yourself in the practice, so that when the phone call comes in with questions and requests of information as a result of this content, you will know exactly what to do to drive them to take the right action. We will also teach you how to follow up with your clients through various means once they've come in, so that you leverage yourself. So what you're getting here is something that is unheard of. There's second to none in our industry, and all this is going to come to you as a bonus when you sign up for this program.
Great. And if there's any questions or you need to ask questions on that, please don't hesitate to ask them in the question box. With that said, I will now move into the pricing. With your 13 campaigns and the bonus offer, the price for the program is $480 or $40 per month. You can select how you would like to take care of that, as well as if you decided to pay, go for the full year and pay in advance, it would be $440, so a nice savings. We are starting the program effective September 1st. We are taking clients' sign-ups now, and each of you will receive a sign-up form after today's presentation. So if you're interested, you can just fill out that form, and we will get you all the information to get you started with your campaigns. So at this point, please feel free to ask any questions. We'll stay on the line for a few more minutes to get those questions answered.
Yes, we did a good job, Mary.
Yeah. One question here is, do we have the ability to add some customization to the message? And Steve and Peter, I'll take that. Yes, you do. The example here is such as product specific that might be mentioned. Absolutely. You do have that ability to tweak where you would want tweaked. So that is no problem whatsoever.
I also want to mention, Mary, that although there are 13 campaigns, you are in charge. So you choose and select which campaign to do when. And how does this work, Mary?
Oh, so once you sign up, you will be receiving a registration form, and it will list all the 13 campaigns out, and you will have a form to fill out which campaign you would like to go which month. You do have flexibility to make edits to that in the future as well. As mentioned, if you did want to use all 13 campaigns, you can use them as well. So, okay. How about Dr. Kornfeld and Dr. Weinstein, we have a question directed to you. How about if we sign up today, do we get a copy of the book for half price? always looking to make a deal.
Actually, I like it. We can send you a code to get the book for 20% discount. How about that?
We're negotiating now, huh?
Well,
Mary, how about if they sign up today?
We got an okay.
I was going to counter Steve's offer and make it even sweeter, but that's okay.
What other questions? Okay, well, I think you guys did a great job, a great turnout today. We had a full house that stayed on right to the end, so appreciate everybody's interest in this. Dr. Kornfeld, Dr. Weinstein, thank you so much for your participation and a really great information that you shared with us today, and this concludes today's presentation.
Thanks, Mary. Thanks, Zubin.
Okay.
Thank you. Bye-bye. Thank you.